Good morning, and thank you all for joining us. I'm Dr. Carol Zimbalati, Public Health Physician with the North Bay Parry Sound District Health Unit. Dr. Chirico is off today. Today, I am joined by Louise Gagne, Director of Community Services, to give an update on our local COVID-19 situation, and Andrea McClellan, Director of COVID-19 Immunization Strategy, who will provide an update on the COVID-19 vaccine rollout. Before we proceed, I'd like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis' historical presence in this region. We must continue to work towards reconciliation. Over the weekend, we shared tragic news of the passing of 2 individuals who tested positive for COVID-19. I send my condolences to their families and friends. While the health unit feels that every death due to the COVID-19 pandemic is tragic, we are making efforts to avoid sensationalizing these events and to align our reporting of COVID-related deaths with the practices of other health units. Moving forward, we will no longer be disseminating news releases when individuals have passed due to COVID-19. The information on the number of deaths will still be available on the COVID-19 status report on our website. Locally, we are starting to see a decrease in the number of people testing positive for COVID-19 and a decrease in community spread. In June, our COVID-19 situation was at a critical level, but thanks to the hard work of our community partners, case numbers are decreasing. While this is good news, the health unit is concerned that we are seeing a significant drop-off in the number of individuals receiving their first dose of the COVID-19 vaccine, and our local rate of vaccination is significantly lower than the provincial or national averages. The proportion of people who are currently immunized leaves significant gaps in coverage for a virus as transmissible as the Delta variant. When making the decision to get your COVID-19 vaccine, it is important to remember that getting the vaccine goes beyond just you. Individuals 11 and younger are currently not eligible to get their COVID-19 vaccine. When you are fully vaccinated, you are helping to prevent further spread, as well as protecting those under the age of 11 and others who are not eligible for the vaccine. Evidence suggests that if a fully vaccinated person does catch COVID-19, there is a reduced risk of transmission to household members. And we know that provincially, only 0.15% of partially vaccinated individuals and 0.02% of fully vaccinated individuals became infected with COVID-19 since COVID-19 vaccines became available in Ontario. A recent study from Ontario suggests that the vaccines used in Canada, namely Pfizer, Moderna, and AstraZeneca, are very effective against the 4 variants of concern, especially after 2 doses. If you are considering being vaccinated and have questions, contact the health unit call center or your healthcare provider. With that, I will pass it over to Ms. Gagne for our local COVID-19 update.
Thank you, Dr. Zimbalati. In the last 7 days, we've had 7 new cases, bringing our total case count to 613, with 433 in the Nipissing district and 180 in the district of Parry Sound. Currently, 3 individuals or cases are in hospital. The health unit has 22 active cases, and of the active cases, 13 have tested positive for a variant of concern, all of which are the Alpha variant. Some new cases, though, are still awaiting further testing. With respect to the Delta variant, 9 cases in our region, 7 in the Nipissing district and 2 in the district of Parry Sound, have tested positive for this variant. However, all of the cases have resolved. As of today, 42 people have tested positive for COVID-19 in connection with the North Bay jail outbreak. No cases have been determined to be community acquired. The outbreak is ongoing, and we will let the public know when the outbreak is over. As of today, we are declaring the outbreak at the Faith Chapel Christian Center in North Bay over, as more than 14 days have passed with no new cases associated with this outbreak. The health unit continues to work with the North Bay COVID-19 Assessment Center, EMS, and other community partners to offer mobile testing and vaccinations for individuals who may experience barriers to accessing these services. In a continued effort to reduce barriers to accessing the COVID-19 vaccine for anyone in our district, the health unit's surveillance and immunization teams are tracking vaccination rates based on geographical locations to determine what areas in the district are seeing a lower uptake of vaccinations. It's important to note, though, that a lower vaccine uptake does not necessarily mean there is vaccine hesitancy. There are a number of reasons why people may face barriers to accessing vaccine, such as work schedules or locations of clinics. By identifying the locations where vaccination rates are low, we can then create a tailored plan to reach those communities. With that, I'll pass it back to Dr. Zimbalati.
Thank you, Ms. Gagne. And now I'll hand it over to Andrea McClellan for an update on our vaccine rollout.
Thanks, Dr. Zimbalati. Good morning, everyone. As of yesterday, 3 p.m., we are now at 75% of adults 18 years of age and older who have received at least one dose of the COVID-19 vaccine, and 49% of adults 18 years of age and over who are fully vaccinated. Additionally, 55% of our youth 12 to 17 years of age have received at least one dose of the COVID-19 vaccine, and 48% have received both doses. As of yesterday at 3 p.m., a total of 137,239 vaccinations have been provided in our district. With the opening of vaccine availability for first and second doses to anyone 12 years of age and older, we've opened up a number of appointments over the next 2 weeks throughout the district and are in the process of planning further clinics for the weeks of July 20th to August 2nd. I encourage everyone to get their first vaccine, to accept the first vaccine available to you and book your appointment. Please don't wait for a specific product. You can book an appointment to receive your second dose sooner than what was automatically scheduled when you first booked your first appointment. We encourage you to book an earlier appointment. By getting your vaccine, you can help protect those who are currently not eligible to be immunized. For those who are 18 years of age and over, Moderna and Pfizer vaccines are completely interchangeable and are both excellent vaccines providing high levels of protection and are based on the same mRNA technology. Vaccine interchangeability is not new. It is a routine practice with a number of vaccine products. Individuals who wish to print proof of their vaccination record can do so on the provincial website by going to www.covid19.ontariohealth.ca. Please make sure you have your health card with you, as you'll require that information to access your record. For more information on vaccine clinics or to put your name or others on our standby list, please visit www.myhealthunit.ca. Now back to you, Dr. Zimbalati.
Thank you, Ms. McClellan. That's it for our prepared remarks. Now we'd like to begin answering your questions. If you have questions, please type them in the Q&A at the left of your screen. Our moderator will read them aloud and we will try to cover as many as we can. When possible, please ensure your name is attached to the question. Alex, please read our first question.
Thank you. Our first question is for yourself, Dr. Zimbalati. It comes from Eric Thompson. Regarding the recent individuals who have died from COVID-19, have the families of the deceased requested that you do not release information regarding their loved ones, or is this a decision the health unit has arrived to on its own? If it's the latter, could you elaborate on why?
This is a policy of the health unit, and according to the Health Protection Promotion Act, and as well as privacy considerations and legislation, we cannot reveal case level data of that nature.
Thank you. Our next question, I think, is both for Dr. Zimbalati as well as Andrea. It comes from Rich Kaufman at mynorthbaynow.com. Are you concerned about local vaccine levels dropping off? Would drop-in clinics help boost these numbers?
I can start, Dr. Zimbalati. Thanks, Rich. That's a great question. We are concerned that we've seemed to have leveled off at about a 75% immunization level for first doses, and we strongly encourage people to continue to receive their vaccine. We recognize that not everybody has the same timetable for when they would like to access the vaccine, and that there may be barriers out there that are preventing people from accessing that vaccine. And that's why the work that Louise referred to with respect to working with our community partners and the data that's available to identify pockets within our communities that may have challenges in accessing clinics, and working to put strategies in place to support them. So yes, we would be looking at possibly mobile clinics, pop-up clinics, and alternative ways of reaching some of those individuals who maybe have not been able to access their first dose vaccine.
Thank you. Our next question is for Dr. Zimbalati. It comes from Eric Tashner from CTV News. The science director of the Ontario Science Advisory Table says the province is not ready to move into the next step of the reopening plan. Does the health unit agree? And if so, why?
Yeah, we would support that evaluation, and thanks for the question. I do believe it is very important when we move into a next stage, as we did on June 30th, to be able to take the time to evaluate the impact of those changes. So I do feel that it is important to retain that 21-day period in between moving between steps, so that we can assess the situation and make decisions accordingly.
Thank you. Our next question is also for you, Dr. Zimbalati. It comes from Tom from Radio Works Parry Sound. Is there any evidence in our health region that supports Israel's claim of a drop in efficacy of the Pfizer vaccine to 64%?
Thanks, Tom, for the question. I wasn't actually aware of that report out of Israel, and no, I wouldn't say that we are seeing that in our health unit district at all. I believe, since January 1st, 90% of our COVID-related cases have been in unvaccinated individuals or individuals who are not yet protected from their first dose because they are less than 14 days out from their first dose. And there are similar statistics that are for our past 14 days of cases. So we really are seeing our cases in those who aren't vaccinated. So in terms of individuals who have been fully vaccinated in our district, we have only had 2 cases amongst those individuals since January 1st, and in the past 14 days we haven't had any. So I wouldn't say that our local data supports that report.
Thank you. Our next question is for Louise. It comes from Michael Lee from The Nugget. Are the 2 most recent deaths related to the outbreaks involving the North Bay Jail and Faith Chapel, or anyone in the homeless community?
Hi, thanks for that question. So I can confirm that the individuals were not connected with the outbreaks. And as Dr. Zimbalati had mentioned, that's we will not be providing any further details relating to these individuals and their circumstances.
Thank you. Our next question is for Andrea, comes from Stu from Bay Today. Any further direction on what is allowed for 2-dose recipients beyond what Health Canada has released?
Not at this time. We are still waiting the provincial direction from the Ontario's Ministry of Health, and so I don't have anything else to offer at this point.
Thank you. Our next question is for Louise. It comes from Michael Lee from The Nugget. Is the health unit able to provide an update on how many cases in the North Bay jail outbreak are active or resolved, and how many currently involve inmate individuals in custody or staff, as well as how much longer do you expect the jail to remain closed for?
Thanks, Eric. So we do know that there's, as of today, 34 cases in the North Bay jail outbreak have recovered. We still have 8 cases that are active. The outbreak is still ongoing, and I can't give a timeline at this point as to when it will be declared over. With respect to the jail reopening, that is a question that you'll have to direct to the Ministry of Solicitor General, as the decision to close the jail or reopen it is a decision that is in their hands.
Thank you. Our next question is also for Louise. It comes from Eric from CTV News. The health unit tweeted that yard sales and garage sale operators and shoppers should follow proper protocol. What extra protocol should those at garage sales and yard sales be following besides the everyday protocol? Have there been any reports or concerns about people at yard sales not following the protocol?
Thanks, Eric. To my knowledge, we have not received any reports or concerns regarding garage sales events. In terms of protocols, individuals who are hosting garage sales should be making sure that there is plenty of space so that people can socially distance, that they're not blocking sidewalks or walkways that would cause congestion. As much as possible, keeping them outdoors, trying to give people advice not to handle products if unnecessarily, keeping sanitizer on hand readily available to individuals who are accessing the garage sale. And also encouraging folks, even though they are outside, they may not be able to fully distance, to continue to wear face coverings as much as possible. And most importantly, if you are not feeling well or you are having any symptoms, you should be choosing to remain at home and not go out into community events such as garage sales. I don't know, Dr. Zimbalati, if you have any other public health measures you'd like to add to that?
Just also that the garage sales would have to respect the numbers of in terms of the step 2 restrictions. So outdoors, that would be 25 individuals.
Thank you. So we have 2 similar questions that came in. They're both going to be for Dr. Zimbalati. So I'm just going to read them both, and then you may provide an answer. So the first is from Michael Lee from The Nugget. With the health unit district on pace to have more than half of all adult residents fully vaccinated this week, at what point would the health unit be comfortable with loosening mask mandates? What other factors besides vaccination rates would the health unit need to consider? And then from Greg Esterbooks, we have BC and Alberta have lifted mask mandates and have reopened to a great degree. Can you account for the different situation in Ontario?
Well, thank you for those questions. Definitely establishing and issuing mask mandates at this point is done by the province. So we would not be issuing any directives that were less than the provincial mandates. In addition, I'd just like to highlight that even though we are seeing and uptake in vaccines. As we mentioned, our local rate is lower than the provincial rate, and the overall rate does not necessarily reflect the rates that you may be encountering in local pockets. So there could be geographic areas or other types of subgroups that would have lower vaccination rates than those posted provincially. So I think we still do need to remain vigilant, and I think it's a measure that we should be keeping in place to protect ourselves and protect others who may not be vaccinated as well, that we continue to physically distance and wear masks if that physical distancing is not able to be done.
Thank you. So that answers all of our questions that were provided for today's press conference. So that will conclude the press conference for today. Thank you, and we'll see you all back next Thursday at 10 a.m. This recording will be available on our website this afternoon. Have a great day.